Hi, welcome back. I am Dr. Chengzi the Orange. In my last video, we discussed the pervasiveness, severity, and the causes of depression disorders. In this talk, we'll focus on the diagnosis and self-assessment. We've all experienced periods of sadness and frustration in our lives. When those feelings persist for an extended period, you might begin to worry, do I have depression? Should I see a therapist or psychologist? Do I need medication? Don't panic. There are established guidelines for diagnosing depression, known as the DSM-5 criteria. The full title of DSM-5 is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This comprehensive guide encompasses 298 mental health conditions, including autism, anxiety, bipolar disorder, PTSD, OCD, eating and sleep disorders, sexual dysfunctions, schizophrenia, and more. With nearly 1,000 pages, that is too much to read. Best leaving it to mental health professionals like clinicians, psychologists, psychiatrists, and researchers. Fortunately, the criteria for diagnosing major depressive disorder are relatively straightforward. There are 9 symptoms of major depressive disorders. A diagnosis requires at least 5 of the following symptoms to have been present for a minimum of 2 weeks. Importantly, one of these symptoms must be either a depressed mood or a loss of interest or pleasure in activities. If you are with a psychologist or psychiatrist, here are the questions you might be asked. 1. For mood change, have you been feeling down or low most days? Experiencing sadness, emptiness, or a sense of hopelessness? Do you cry often without a clear reason? For children or teenagers, have you been feeling extra grumpy or upset lately? Do you get frustrated or angry more easily, even over things that wouldn't usually bother you? 2. Loss of interest or pleasure. Do you feel like you no longer enjoy activities or hobbies you used to love, or that you've lost interest in spending time with others? 3. Changes in appetite or weight. Have you noticed significant changes in your appetite or weight? For instance, are you eating much more or much less than usual? Or have you gained or lost weight without trying? 4. Sleep disturbance. Are you having trouble sleeping, like difficulty falling asleep, waking up frequently, or sleeping much more than usual? 5. Changes in movement of activity. Have you been feeling unusually restless, unable to sit still, or moving and acting more slowly than usual? Have others mentioned these changes to you? 6. Fatigue or low energy. Do you often feel tired or drained of energy, even without much physical or mental exertion? 7. Feeling of worthlessness or excessive guilt. Do you feel like you're not good enough or overly critical of yourself? Have you experienced strong feelings of guilt over minor things others wouldn't think twice about? 8. Difficulty in concentrating or making decisions. Are you having trouble focusing, thinking clearly, or making decisions? Have others noticed or commented on this? 9. Thoughts of death or suicide. Have you been having thoughts about death or dying? Have you thought about ending your life or even considered how you might do it? If the individual answers yes to many of the above questions, particularly the first or second, the psychologist may dig deeper to ensure the symptoms meet the diagnostic threshold and aren't caused by other factors. 1. Are these feelings or experiences significantly affecting your ability to function in daily life, such as your relationships, work, or school? Answer should be yes. 2. Are you using substances like alcohol or drugs? Are you taking any medications, such as for blood pressure, seizures, birth control, or hormone therapy? Answer should be no. 3. Have you ever been diagnosed with another mental health condition like schizophrenia? Answer should be no. 4. Have you experienced periods of extreme energy, heightened happiness, or unusual irritability where you didn't need much sleep and felt unstoppable? Answer should be no, as these indicate bipolar disorder. In addition to the specific criteria for major depressive disorder, the DSM-5 offers optional specifiers to give a more detailed picture of the condition. These specifiers highlight unique features of a person's depression, helping tailor treatment and predict recovery. But don't worry if you have some characteristics of these specifiers. You may just have the personality of a very creative artist, musician, writer, or an inspiring politician. Here are the specifiers. 1. With anxious distress. This specifier describes depression that's paired with high levels of anxiety. 2. With mixed features. Here, depression and manic-like symptoms occur together, but not to the extent of bipolar disorder. 3. With melancholic features. This is a severe form of depression where life feels utterly joyless. 4. With atypical features. This describes a unique form of depression with surprising characteristics, such as increased appetite or noticeable weight gain, sleeping far more than usual, a heavy, leaden feeling in arms or legs, or extreme sensitivity to criticism or rejection. 5. Depression accompanied by psychosis like hallucinations, delusions, or paranoid beliefs. 6. With catatonia, such as stuck in rigid or awkward body positions, becoming completely motionless or mute, or extremely agitated for no reason. 7. With peripartum onset, which applies to depression that begins during pregnancy or shortly after childbirth. 8. With seasonal pattern happens typically during fall and winter when sunlight is scarce. Some curious kids might wonder, there are so many people who meet the criteria for major depression, like Naoko and Reiko in Norwegian Wood, but their symptoms can look so different. How do clinicians figure out the type and severity of a person's depression? How do they decide on the right treatment, and what do they use to track whether it's working or how the person might recover? Great questions! Just like blood sugar levels are a key measure for diagnosing diabetes, depression symptoms can also be measured and standardized using structured diagnostic interviews. These tools help clinicians assess, diagnose, and monitor depression consistently. Many types of interviews have been developed based on the DSM-5, each with its own strengths and uses. Let's explore some of the most used ones and when they're typically applied. Here are the most used diagnostic interviews. I believe that only truly hardworking kids will have interest to look at it. Those interviews are designed to assess the severity and track the treatment response of depression disorders. I'm afraid that only very curious kids may take a look at it. The interviews in those two tables, even if we can access with some payment, need to be done by trained professionals because they're like a guided conversation with a purpose. They are structured and flexible. Clinicians know how to ask the right follow-up questions, spot subtle differences in symptoms, like whether fatigue is from depression or something else, and keep the process accurate. They also handle sensitive topics like thoughts of suicide with care and can step in if immediate help is needed. It's not just about asking questions, it's about understanding the whole picture of the patient safely and professionally. Except for the interviews that are typically conducted by clinicians, mental health professionals, and researchers, there are numerous tools available for self-assessment of depression disorders. Many clinicians and psychologists recommend that individuals complete a self-assessment before consulting a healthcare professional. This approach can help reduce costs for patients and alleviate the burden on the healthcare system. However, self-diagnosis and self-description of antidepressants are strongly discouraged. Relying on online resources or self-applied standards may lead individuals to perceive their condition as more severe than it truly is. Moreover, self-prescribed medications may make their situations even worse. This table lists the most commonly used tools for self-assessment, all of which have free online tests available. The PHQ-9 is one of the most widely used tools, both for initial screening and as a means to monitor the severity of symptoms over time. This is a sample PHQ-9 questionnaire. The total score ranges from 0 to 27. If a person gets a score of 10 or more, he or she should consider getting a more comprehensive evaluation from a psychological specialist. If you are super busy, you can take a quick screening using PHQ-2, the preliminary version of PHQ-9. If you get a score of 3 or higher, it's recommended to test with the full PHQ-9. In addition to the classic diagnostic or self-assessment methods, in January 2024, FDA approved the first AI-based depression assessment tool, the AI-generated Clinical Outcome Assessment, AI CoATM. It was only accepted into the ISTAND pilot program to support drug development, not a full FDA approval yet. Many people might think that, since depression is so common, large-scale screening programs should be implemented, similar to those for breast and colon cancer. Such programs could enable early intervention for high-risk individuals, improving health outcomes and easing healthcare system burdens. However, to date, large-scale depression screening has not demonstrated significant benefits. One major obstacle is the stigma surrounding mental health. Individuals diagnosed with depression are often unfairly perceived as weak or unstable rather than as patients in need of care. This stigma can result in discrimination in employment opportunities and increased medical insurance costs. Furthermore, the high rate of false positives in screenings could lead to unnecessary psychological stress and additional medical expenses. We are reaching the end of this video. In our next talk, we'll discuss the treatment and prognosis of depression disorders. Thank you for watching. See you soon.